Hi guys, today we're going to talk about instructions after getting an extraction. After having the extraction done, the most important thing is to follow the instructions. If you follow instructions, you have less pain, less swelling, and you can return to work and other activities sooner than if you hadn't followed the instructions. After having the extraction done, you're going to have some bleeding in your mouth. For the first hour, it's really important that you bite on the piece of gauze that we gave you, because that gauze is going to keep pressure on the tissue and form a clot. And that clot has to stabilize in the first 24 hours. Now, in the first 1 hour, if you keep opening your mouth and closing, opening and closing, what's going to happen is the bleeding will continue because you're not putting constant pressure on the tissue. So even if your gauze is wet with saliva or blood, it's totally fine. You don't need to change that out. You just need to keep biting with pressure, and the bleeding will stop and form a clot. Now, the clot is much like a scab on your skin. When you get a cut, you want to have the scab stay on. Now, the clot is much more fragile than a scab, and when the scab comes off too soon, it's not good. But when the clot comes out too soon, it's really not good, because then you have something called a dry socket. And dry sockets can be really painful because it's basically naked bone exposed to air. On a side note, we offer PRF, which is basically drawing your blood to form this platelet-rich fibrin. PRF reduces your chances of having a dry socket. So the clot has to stabilize in the first 24 hours, and that means no rinsing or no spitting. So it's really important. You're going to want to rinse and spit because there's going to be a little bit of blood in your mouth. But if you rinse or spit, the clot's going to be lost and you're going to have a lot of pain. So even if you want to rinse with Listerine or salt water, don't do any of that for the first 24 hours. You're going to want to spit too, but if you keep spitting, the clot will be lost and you'll have a dry socket. So first 24 hours really important. No rinsing, no spitting. Now some patients ask, can I eat in the first 24 hours? And the answer is yes, but just no rinsing, no spitting. If you're drinking something, just don't swish it around like you're rinsing. You can just drink it and it's going to be fine. During those 24 hours and for up to a week, no drinking through a straw. If you drink through a straw, then you're basically suctioning out the clot. So no drinking through a straw. So no smoking and no drinking for up to a week. And especially if before coming to the appointment, you don't want to be drinking the day before. You're going to have more bruising and more bleeding afterwards. But you do have to take all your medications before having extraction done, unless told by your dentist or doctor to not do so. Also, for the first couple days, don't go work out or lift heavy stuff, because if you work out and move your body around a lot and use your muscles, your blood pressure will go up and there's a chance the bleeding can start again from the extraction site. So sometimes after biting on the gauze for 1 hour, you can have some bleeding, and if you have some more bleeding, we usually give you another pack of gauze to bite on for 30 more minutes, and that does the trick. Sometimes if it doesn't, you can use a tea bag and bite on the tea bag, and some of the contents of the tea can stop the bleeding a little bit faster. Most of the time when we do extractions, you're not going to expect too much swelling. But sometimes if the extraction is difficult, like an impacted wisdom tooth, you can expect some swelling. And in that case, we're going to give you some ice packs. And the way to use the ice packs is to put the ice pack on for 20 minutes on and then take it off for 20 minutes. You don't want to be putting it on for a very long time. It's not good for the skin. And you also want to wrap the ice, or what we also prefer is to use frozen vegetables, and 20 minutes on, 20 minutes on, off for the first 2 to 3 days. This is going to help with swelling if we anticipate it. You're going to want to sleep with a couple pillows so your head is elevated. That way you're going to have less bleeding for the first couple nights. Also, many patients ask, can I brush my teeth tonight? We don't recommend you brushing your teeth the day of, because then you're going to have to rinse and spit, which is the 2 things that we don't want you to do. But after 24 hours, you can brush your teeth, just not the area that we had the work done. And you can start rinsing after 24 hours gently with warm salt water, but no vigorous rinsing. Again, if you have any questions, please call us, or you can also call myself. My cell number is on the post-op instructions, every post-op instructions that we give, so you can call or text anytime with questions. And please follow the instructions, that's the most important thing. We also give you antibiotics and pain medications as necessary, and if they're necessary, it's necessary to take them so we don't have infections and pain afterwards. It's less swelling as well. With the antibiotics, we do encourage you to take some probiotics with it that helps your stomach not get so upset with antibiotics. If you need an extraction and you've been putting it off because you have fear or anxiety about the procedure, we are offering various levels of sedation at our office. Nitrous, conscious sedation, which is taking a pill, and also IV sedation, which is way more predictable. And that way you don't have to be afraid. You're not going to be totally asleep through the procedure, but you will be much more relaxed. And most times you forget about the experience, so you don't even remember it. And before you know it, the procedure will be done. So please give us a call if you have any questions. We look forward to seeing you soon.